As a chiropractic patient, have you ever wondered what are some of the biggest mistakes that most people make? Now listen, everybody wants the same thing. They want to get out of pain as quickly as possible. They want to move through the recovery process and the corrective process as speedily as they possibly can, and they want to maintain for as long as possible. Well, if that's what you want, we're going to talk about the 3 mistakes that most of our patients make here at the Limerick Chiropractic Center. In fact, at the end, I'm going to give you a bonus item, which we're going to cover in a few minutes. So hang on tight. Now, guys, listen, we're going right to the tables, all right? In fact, we're going to be pulling out the big guns right away, and that is our wallet. See, the sad thing is we've been trained to take this thing and stick it in our back pocket, and when we leave the house, well, it stays there unless we're pulling it out in order to pay for something. Well, the problem is that we're driving in the car. We're sitting at our desk for 6, 7, 8 hours. We consume meals, we sleep, we go to bed, and only take it out at night. Guess what? The problem is that this thing causes us to create unleveling in our hips and our pelvis. And listen, because we have that unleveling, well, guess what? The rest of the spine is going to be shifted because of it. Now, many of you are saying, hey, listen, what are you talking about? Well, let me use this little block here to help you demonstrate. Because you're taking this thing and you're shoving it underneath your butt, and you can see how my hips are no longer nice and level. And the problem is that you and I, we're not doing this for 5 or 10 minutes. We're doing this for hours and days and years of our lives. And we wonder, why in the world are my hips still not level? Why is my low back pain not getting any better? Or why is it taking longer than it's supposed to? In fact, an easy exercise for some of you to better understand how this actually affects you, take this, drop it on the floor, and what I want you to do is I want you to stand up and put one of your heels on it, and try and go ahead and feel like you're standing straight and level. Listen, this feels awkward. I could tell the difference, and yet we're shoving this thing underneath our butt, and we don't think anything of it. Now listen, guys, it's not all about you. Just saying, large part of our population are female patient base here in the office. Many of them come in with their purses, and they're taking these things, and they're all different sizes. And I want to make sure that we cover this right away. It doesn't matter the size of the purse, because we cannot remove reflexes that are already inside of your body. And in turn, those reflexes, as soon as you take this purse and put it on your shoulder, your brain only knows one thing. It knows that it doesn't want this strap falling off the side of your shoulder. It doesn't want your purse falling to the ground and spilling out all over the place. So what it does is it takes and it elevates that shoulder to make sure that it doesn't fall off. Now listen, sometimes this weighs maybe about a pound. Other times it weighs about 20. Guys, don't laugh. They can fit an awful lot of stuff in here. Some of that stuff is pretty darn heavy. I mean, you and I, we have to put in our pants pockets, but listen, we can pack this thing full. A couple days worth of lunches will go in here. But here's the thing, innately, as soon as you put it here, guess what? Your shoulder wants to come up, and when you're doing posture checks and you're seeing how unlevel those shoulders are, guess what? One of the things that happens is that normally we continue to feed into that bad posture, and we put that purse on the same side. Listen, we all get into habits. We all get into those routines, and it's those routines that produce an outcome that we visibly get to see in our posture checks. Now, from there, this is everybody. and this is crossing your legs. And I don't care how you cross your legs. I don't care whether you're crossing them out, putting them up here in this figure 4, whether you're crossing them at the knees. Guess what? What you're doing is you're rotating your hips and your pelvis. You're twisting yourself around, and when it comes to the nerves that are at the base of your low back, guess what? You're screwing up not just your sciatic nerve, all the nerves that go down your legs, but also nerves that are responsible for some of your digestive system, your bladder, your uterus, your ovaries, guides, your prostate. All of those nerves come from this area. So as we're twisting and putting pressure on those nerves, bad things are happening inside of our body. Now, a lot of people say, well, you know what? It's just a little thing. Well, guess what? I've been in business meetings. I've sat there at conferences. I've watched people as they do this, not for just a few minutes, but for hours and hours. Well, listen, if you walk around and your head's tilted to the side, you know what? This might be a little uncomfortable after a while for your body. Guess what? This becomes uncomfortable for your low back. And if you ever want to wonder, and you ever want to find out exactly how off balance this produces, this changes your system and produces problems for you, guess what? You stand up and cross your legs, and you'll find that somebody comes along and just pushes you a little bit, how much less balance you have because of it. This certainly doesn't look very balanced as I'm standing here like this. Now, I guarantee you, we are going to go over a couple things that are killers and really bad mistakes for your correction and for your progress. But here's the thing. Adults, listen, this is not all about you. We're concerned about you taking this information and sharing it with the next generation. In fact, one of the bad mistakes that we get to witness all the time starts this time of the year. It happens to be our kids' backpacks. This is like a cell phone. They hand you this device. They give it to you at the phone store. And nobody says, hey, listen, this is how you have to use it. This is the proper position for it. This is how long you're supposed to use it for. This is how to neutralize those electromagnetics. Nope, doesn't happen. Guess what? This thing too. Parents, we are ill-trained. We have no training whatsoever in how to make sure that this thing is fitted properly for our children. And the problem is that we are producing spinal problems for our children. I don't want you taking my word for it. You Google how many emergency room visits from backpacks. How much should a backpack weigh? Listen, maximum is 15% of the child's body weight. Most of you out there had no idea that number. That's not a lot of weight. And yet, you know what? You see kids, they're slinging this thing over one shoulder. Remember, this is like the purse. They're going to hike their shoulder up. They're going to cause their posture to become out of balance. Unfortunately, as it's too much weight in here, what ends up happening? They start getting pulled back. So guess what? They're going to correct for this, and they're going to lean forward. You've seen those little kids walking to the bus stop just like this. Their head down, their butt out, and this thing just slapped on their back. And the problem is that our young children, day after day, are slugging this thing around and creating back problems. Our desire is not for our children to be that next generation that destroys their spine. Our desire at the Limerick Chiropractic Center is to make sure that our next generation is protected from these spinal issues. Listen, they look like it's on the outside. They look like it's on the inside. And our desire is to make sure that our kids at least get set up for success. So, as always, listen, one big thing that I'm going to recommend is making sure that we spend the time and see that our children actually get checked. If your child's backpack has never been checked for them, listen, we're going to do that as a complimentary service for our patients at the Limerick Chiropractic Center. It's simple, it's easy, and it's very quick. And pictures are worth 1,000 words, which means we get to not only see what that child's posture is like before putting their backpack on, but the effect that the backpack has on them, and then we're capable of setting the backpack up correctly to reduce the stress and strain. As a gift to our community, as a gift to our patients, we would enjoy doing that for you. As always, I ask you to do 3 things with this video. Make sure that you like the video. I want you to share this video with your Facebook friends. But third, tonight, I ask you to leave me a comment. Of the 3 things, what's the big thing, that big mistake that you're making? What's the aha for you of, yeah, I'm doing that and I need to create changes? I want you to leave me a message below. Leave me a message in the comments section. I'd love to work with you on making sure that we clean that up so that your progress happens as quickly as possible. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.